For decades, the standard response to obesity has been a punishing cycle of extreme dieting and exhausting exercise, usually driven by a sense of personal guilt. We are often told to simply try harder, but the data shows that for the vast majority of people, trying to out-willpower human physiology does not produce sustainable results. The medical community now recognizes obesity as a complex, chronic, and treatable disease, not a lack of discipline. It is driven by biological and hormonal factors. When you severely restrict calories, your body chemistry shifts to preserve fat, making sustained weight loss physically resistant. Overcoming those ingrained biological barriers requires medical intervention, much like any other chronic illness. Past struggles were not a sign of personal failure. They were the predictable result of trying to treat a biological disease with the wrong tools. Excess weight frequently coincides with a multi-system malfunction known as metabolic syndrome. This condition has 5 markers: large waist, high triglycerides, low HDL, high blood pressure, and elevated glucose. 3 triggers a diagnosis. At the center is insulin resistance, the biological engine driving them. Untreated, it increases cardiovascular and diabetes risks. Sustainable fat loss is about more than the bathroom scale. It is a clinical intervention to disarm these internal risks. In Miami, Paradise Medical Center acts as the clinical ground for treating these overlapping conditions holistically. Step 1 of their clinical fat loss program bypasses arbitrary goals and starts with a comprehensive metabolic assessment. Through in-office labs, the medical team captures data on A1C, fasting insulin, liver function, and complete lipid panels. Measuring these markers ensure that weight loss is actively repairing internal metabolic health, rather than just burning away muscle mass. True obesity treatment requires mapping a patient's unique internal chemistry first, proving why expert primary care oversight is a necessity. Step 2 utilizes FDA-approved therapies to address the biological signals that control appetite. The clinic utilizes GLP-1 medications, including specific options like Wegovy and Ozempic. They also manage dual agonist medications, such as Mounjaro, ensuring patients have access to the exact intervention their body requires. These therapies reduce appetite signals in the brain and slow gastric emptying in the stomach. Clinical data shows patients consistently achieve a 15 to 22% body weight reduction over a 12 to 18-month timeline. In practice, these are self-administered injectable pens. The medical team handles dose titration and navigates the prior authorization process. GLP-1 therapy addresses the hormones that cause weight regain, making fat loss physiologically achievable for the first time. While clinical therapy addresses the internal hormonal obstacles, steps 3 and 4 provide the essential structure for long-term health. The team provides practical, bilingual nutrition and behavioral coaching in both Spanish and English. They focus on sustainable changes rather than extreme diets. Simultaneously, the primary care team manages the blood pressure and cholesterol issues identified during your initial assessment. Because metabolic syndrome is a cardiovascular disease, behavioral coaching and medicine must work together to rebuild a patient's health. Obesity is a chronic condition, which brings us to step 5, long-term maintenance. Ongoing care is necessary to prevent the weight regain that often follows initial loss. To assist during this phase, the clinic offers B12 injections to help patients maintain their energy levels while in a caloric deficit. The goal is to move past the cycle of yo-yo dieting and into a permanently managed, healthy metabolic state. Willpower alone is rarely enough to change human biology, but combining medical science with structured support provides a path forward. Stop blaming yourself and instead book a personalized consultation with Dr. Teresa Marino's bilingual team at Paradise Medical Center by calling 305-676-8217.